Hello ma'am, hello everyone. I am Irene Morrison Tayag, a first year midwifery. Today, I'm going to discuss my topic which is communicable disease. I will discuss 10 common and well-known diseases or viruses, and I will show you some videos regarding this. The 10 common communicable disease are the COVID-19, the flu, hepatitis A, hepatitis B, AIDS or HIV, measles, rabies, STD, and tuberculosis. What come up on your mind when you hear the word communicable disease? What is communicable disease? Communicable disease is one that spread from one person to another through a variety of ways that can include contact with blood, bodily fluids, breathing in airborne, or being bitten by an animals or insect.
Microorganisms are a group of tiny organisms, including bacteria, viruses, protists, and fungi. Although most of them don't cause us any problem, a small group of them do, and we call these pathogens, which we can define as microorganisms that can cause disease. As the pathogens can spread from person to person, the diseases they cause are known as communicable.
And how do these communicable diseases spread? First is by physical contact with an infected person. Secondly is contact with a contaminated surface or an object. The third is bites from insects or animals. And lastly is travel through air such as tuberculosis and measles. The first in 10 common communicable diseases or viruses is COVID-19. We are all know that COVID-19 are the latest, deadly, and fast-spreading virus. We are all suffering more than 2 years in this virus. And we thank you for all the scientists who discovered the vaccines to prevent COVID-19. According to World Health Organization, the most common symptoms of COVID-19 are fever, tiredness, and dry cough. Few patients experience aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. So how can we prevent the COVID-19? Wear masks, save lives. Wear a mask, clean your hands, social distancing, be vaccinated, and you must stay at home, especially to the seniors and children. So if anyone that having symptoms of COVID-19, don't hesitate and afraid to go to the nearest hospitals to be treated. Second to the communicable diseases or viruses is the flu. Flu is a contagious respiratory illness caused by the influenza viruses that infect the nose, the throat, and sometimes the lungs. The best way to prevent this flu is getting vaccines every year. There are some symptoms of flu. First is chills, fever, cough, sore throat, runny nose, stuffy nose, body aches, headaches, and fatigues. And if you are suffering this kind of symptoms, you may also consult to the doctor for your fast recovery and to be treated also. Next is hepatitis A or Hepa A. Hepatitis A is an inflammation of liver that causes mild to severe illness. It is transmitted through ingestion of contaminated food, water, or through direct contact with an infectious person. It can be spread from close personal contact with an infected person such as through certain types of sexual contact and caring for someone who is ill. It can be also life-threatening if it causes the liver to stop working properly or having a liver failure. Hepatitis A vaccine is available for people at high risk of infection. Next is hepatitis B. In these cases, hepatitis B can be transmitted from mother to the child during birth. Hepatitis B also a vaccine preventable. It is spread by blood, semen, or other fluids of an infected person with the viruses enters the body of someone who is not infected. There are also signs and symptoms of hepatitis B. First is having abdominal pain, dark urine, weaknesses and fatigue, fever, joint pain, loss of appetite, nausea and vomiting, yellowing of skin, and the whites of your eyes. Signs and symptoms of hepatitis B is range from mild to severe. Next is HIV or AIDS. The human immunodeficiency viruses are the viruses that damage the cell in your immune system and weakens your ability to fight everyday infections and disease. It is also the viruses that attacks your body's immune system. If it is not treated, it can lead to AIDS or acquired immunodeficiency syndrome. There is currently no effective cure. Once people get HIV, they have it all for life. Treated HIV typically turns into AIDS in about 8 to 10 years. You can get HIV from contact with infected blood, semen, or vaginal fluids. Most of the people get viruses of having unprotected sex with someone who has HIV. If you didn't know earlier that you were infected with HIV, you may realize it after you having some of these symptoms. First is being tired all the time. Secondly is swollen lymph nodes in your neck or groin. Third is fever that lasts more than 10 days. Fourth is night sweats. Fifth, weight loss with no obvious reason. And lastly, purple spots on your skin that don't go away. There is no cure. However, there are many medications that control HIV and to prevent complications. These medications are called antiretroviral therapy or ARTs. Next is measles. Measles symptoms appear to 7 to 14 days after contact with the viruses and typically include the high fever, cough, runny nose, and watery eyes. Of course, measles is dangerous to the babies and young children. 3 to 5 days after the symptoms begin, the rashes breaks out. It can usually begins at the flat red spots appear on your face, the hairline, and spread downward to the neck, the trunk, the arms, the legs, and the feet. Next is the rabies. The rabies is deadly virus spread to the people from saliva of the infected animals. The rabies viruses is usually transmitted through a bite of the animals. After a bite, or rabies exposure, the rabies viruses has to travel through the body to the brain before it can cause symptoms. The first symptoms of rabies may be very similar to those of having flu, generally weakness or discomfort, fever, and headache. If you have bitten by an animal that is known to have rabies, you must receive or go to the nearest hospitals or rabies center to get shots of anti-rabies vaccine to prevent virus. Next, the STD or the sexually transmitted diseases. STD are the infections that are passed from the person to another through sexual contact or intercourse. The contact is usually vaginal, oral, in the anal sex, but sometimes they can spread through other intimate physical contact. Bacterial STDs can be cured with antibiotics if treated begins early in. There are same symptoms for men and women. First is pain or discomfort, sex or urination. Second, sores, bumps, rashes on around the penis or vagina, testicles, anus, buttocks, thighs, or mouth. The third is unusual discharge or bleeding from the penis or vagina. Next is painful or swollen testicles or itchiness in or around the vagina. Laboratory tests can be identify the cause and detect co-infections you might also have. The blood test, the urine samples, and the fluid samples. Lastly is the tuberculosis. Tuberculosis is the diseases caused by the bacteria called Mycobacterium tuberculosis. Tuberculosis is the bacteria usually attacks the lungs, but they can also damage the other parts of the body. It is transmitted or spread by cough, by the blood, sneaks, or either by talking. The signs and symptoms of active tuberculosis include coughing for 3 or more weeks, coughing out of blood or mucus, chest pain or pain of breathing or coughing, unintentional weight loss, fatigue, fever, night sweats, chills, and lastly is loss of appetite. Thank you for watching and listening.